has developed a differential licensing tool for Massachusetts and how differential licensing will be used by by family child care and by group and school-age licensors. Additionally, the webinar will address how differential licensing will affect you as a provider and how your renewal visits may change in the future. We welcome all of your questions and will provide you with additional opportunities to learn more about differential licensing in Massachusetts. So thank you again for your participation this evening, and I'm going to turn it over now to Tina.
Thanks, Carmel. So I'll start us off. Looks like there is someone saying there's no sound. If you can hear, please let Zane know and say yes that you can hear me.
Yes. Yes.
Yep.
Okay, great.
I'm getting.
Zane, you're able to hear us as well?
Yes.
Yes.
Thank you so much.
Yes. Yes.
Yes.
So I completely close my eyes.
Yes.
In the medicine cabinet for a minute.
Yes. All right, thanks everyone.
Okay, going to put everybody back on mute. Sorry about that, folks. Thanks so much. I'm going to, let's see here. All right, go ahead, Tina. And I think you need to reshare your screen, please.
Okay.
Folks are not, I think we have no visual on your side.
Okay, give me 1 second and I'll reshare my screen. So it looks like there are a few people that I think are touching the participant section and taking over the screen share. So we ask that you please not touch the participant section. If you do have questions, please use the chat function, and I'll actually just go back to that slide for you. Right here we have a screenshot of what what the screen should look like. So on the right-hand side, under the participant tab, there's the chat function. So if you have any questions, comments, or issues, please type them to Zane Wyrick at the bottom right-hand corner.
And Tina, I'm going to just
as Zane mentioned, we're going to keep everyone else on mute. Go ahead, Zane, sorry.
And I'm going to do one more mass remute and then unmute you real quick.
Okay, thank you.
Well, I think you might be exempt from it, actually. Go ahead.
Okay. All right, so we'll start off by talking about generally what is differential licensing. So differential licensing is a new approach to licensing and monitoring through risk assessment and tailored monitoring. So I'm getting some feedback that we're not loud enough. We are at a high volume here. So on your end, if you're not able to hear us, please try to turn up your own volume. Unfortunately, there's not much more we can do on our end.
And on top of that, too, please be sure to mute your own phones as well. That will help us in being sure that there's no background noise. Thank you.
All right, thanks for everyone for dealing with our IT issues. We have a large group, so it's a little bit difficult to make sure that everyone can hear. We will, at the end of this, post the materials and make them available. We'll also post the recording, so the recording should have clear audio as well. So for any reason why you couldn't successfully participate in this, there's always the posted recording. Okay. All right, so we're going to start off by talking a little bit about the mission. So this mission was created by not only EEC leadership, but by EEC licensors themselves. So sounds like, I'm sorry, it's still a little echoey. Unfortunately, there's not much more we can do on our end. But again, there is the recording that we'll send out afterwards. So the mission of the differential licensing model is really fourfold. So first and foremost, EEC is looking to promote health and safety at the very core of this. And once health and safety is established, we're also very interested in promoting the quality of education, early education and care programming. In order to do so, the mission of the model is to increase monitoring, but to do so by tailoring those monitoring visits to program needs. In addition, the mission of the model is to support effective allocation both of EEC's resources, but also of the technical assistance from the department to use to help you promote health and safety and quality in your program. So I'm hearing an echo, which I believe is due to maybe people not being muted. So Zane, if you could help me out and just double check that everyone's muted, and then those on the phone, if you could mute yourself manually, that would be much appreciated as well.
Got it.
Okay, so differential licensing is also referred to nationally as differential monitoring. It's a best practices method and nationally to determine frequency and or depth of monitoring for child care providers. So many states have some form of differential licensing or differential monitoring. And overall, states are looking to increase monitoring, again, while tailoring those visits and technical assistance to program compliance history and also their technical assistance needs. The monitoring process, having a differential piece to it, also helps with efficiency with business processes. So really spending more time with programs that need the additional assistance and really having a lighter touch for those programs that are doing very well and that are very compliant with health and safety regulations. So EEC started to go down this path of creating a new licensing process and licensing model due to the Child Care Development Block Grant reauthorization that occurred in 2014. So the reauthorization requires that states review programs annually on an unannounced basis. So EEC began to develop this process to comply to the block grant, but also because, as we mentioned earlier, it's a national best practice and really to promote the health and safety of children in child care programs across the nation. So on this next slide, we talk about here, this is developed by licensors for licensors. So the process and the work began back in the fall of 2013. EEC leadership was very dedicated to the idea of making sure that this model really fits Massachusetts provider needs. And so subcommittees of licensing staff who are on the ground with you, who understand your needs and your compliance history, they are the ones who begin to meet to develop this new model. Then in the spring and summer of 2014, they hired EEC, contracted with Public Consulting Group. So we are a national consulting firm that focuses on government consulting. We came and helped work with the subcommittees to bring in research, national best practices. We helped connect EEC and the subcommittees with other states who have created a differential licensing model or are on the cusp of creating it in the beginning stages. Additionally, EEC received technical assistance from the Office of Child Care, National Center on Child Care Quality Improvements. And through all of this, combined with the licensor's knowledge of Massachusetts landscape, created a model that we then piloted in the fall of 2014. So many of you on the phone may have participated in the pilot. We thank you for that. That was a great chance for EEC and licensing staff to test out the model in real time. And the model was tested with family child care center-based, so group and school age, as well as residential placement. So across the state through all different types of providers. That pilot, we collected information and feedback from licensors who participated, as well as programs who participated. So we thank you for your feedback. We used that to then in January through April 2015, revise the tools and the processes, and then create a new model, a more improved model, and we piloted that again in May to June of 2015. That process was the same in terms of feedback. We got feedback from licensors as well as you all, providers themselves, providers and educators, and took that feedback and created and finalized the new business processes and models, and then EEC staff went through training. That was, again, around fall of 2015 into now, bringing us to today. EEC is ready to fully implement the system, the new model, and full implementation will begin this fall. We recognize that this will be a phased process. So we're beginning with sharing the information with you, and licensing staff are starting to begin to implement this process. You'll see this implemented over time. You also see in this timeline, there's a dotted line from January until now, that there's a new IT system redesign as well. So EEC contracted with a company called Encapsulate to build a new IT system that would incorporate the new model and really help with both EEC licensors and providers in having more efficient processes, so having less paperwork and more real-time information. So that as well, the IT system as well, is slowly phasing out at the same time that full implementation is being phased out this fall. Okay, so we talked a little bit about all of these components that are on this graphic, but we want to reiterate that at the core of this whole model, the new change in licensing and the processes that EEC will conduct is really focusing on annual provider visits, going out more often, being there in the programs and helping you ensure that your program is health and safe for children. So at the annual provider visits, for family and small, large group and school-age programs, licensors will now conduct annual unannounced visits. Surrounding that are new business processes, so policies and practices that will help reach those annual visits. And those policies and procedures are meant to help EEC conduct visits more efficiently, which will hopefully benefit for you as well, so that you can receive your feedback and documentation also more efficiently. To further help with efficiency, as we mentioned, EEC contracted to redesign their IT system. It's called LEAD. And that technology system, LEAD, incorporates all of the policies and practices that get to annual provider visits. Additionally, you may have already started to see that your EEC licensor has been conducting visits with iPads. And the iPads link directly to this new IT system, and the goal of both of the technology and the policies and procedures are to create more efficient visits so that your time is spent more on the visits and technical assistance and less on paperwork. Right, so all of these components comprise the licensing model. So differential licensing will promote provider compliance through workforce development. And so what we mean by that is when we mention there will be more time for technical assistance, because the tools that licensors will use will focus on key indicators, so real key indicators of risk of harm to children in your programs. So the increased time, the time savings will give increased time for technical assistance and help drive workforce development and really allow EEC licensors to work in partnership with you. We talked a lot about increased efficiency through the new business processes and the IT systems. Eventually, you'll begin to see EEC, once the IT system is rolled out, a portion where you can more easily respond to requests from EEC. Overall, you'll see increased monitoring effectiveness via the risk-based assessment model, which looks at key indicators, which are a subset of current regulations that you comply with today. And additionally, licensors will focus more on program quality. So once we establish compliance with health and safety, being able to work with you to increase your program quality. All right. So as we mentioned, differential licensing is more than just annual visits. Some improvements you'll see are more tailored visits that are specific to your noncompliance history and other activities, more time for technical assistance. The new model will also allow licensors to recognize best practices for health and safety. And overall, compliant programs will see shorter visits, and they will be more targeted with your needs. Okay, so I'm going to hand it over now to Donna Cohen Avery, who is the Associate Commissioner for Field Operations Policy.
Hi, I'm Donna Cohen Avery, and in addition to being the Associate Commissioner for Field Operations Policy, I'm also a Regional Director. So I work directly with licensors daily, and I oversee in my region family child care and small and large group and school age licensing. So I'm very familiar with what a licensing visit looks like and what the relationship between EEC and providers and educators is in the field. So I just wanted to put that out there so people understand that I have a day-to-day role in this work in addition to the work that I do on the statewide level. Tina and folks have gone over this throughout the presentation, but really how this will benefit you is that if you are compliant with the regulations, you'll see that the majority of the visits that you have will be definitely more focused than the ones that you've had in the past. Right now in our licensing processes, depending on the particular kind of care you're licensed to provide, your visit could be anywhere from a half a day to a full day to, in some cases, more than that. And we're looking to really not paint everybody with one brush, but to make this so that it tailors itself to what's actually happening at your program, what's the most helpful so that you can be in compliance with the regulations, because that is our goal. It's to make sure that programs can figure out how to be compliant and that we provide the technical assistance to allow you to do that and to provide the most quality program that you can. So we're hoping that these focused visits will really be able to allow us to do that. And I'm sure when we get into the question and answers, we'll get into some details about those. The technical assistance piece, as Tina mentioned, we will be recognizing best practice, and by that we don't just mean we're going to tell you when we're in the program that you're conducting a best practice. We're actually going to put that into the written feedback that you get following the visit. So your licensing visits will no longer just have a list of noncompliances. It would also have a list of here are the places where you're conducting best practice, and that I think will help to make that feel like a more balanced document, but to also better reflect the visit that we did. I think for family child care, this is not tremendously different because the tool that licensors have been using in the field, they might put notes now, but those notes would be more based on a licensor's observations as opposed to the licensor's observations as it ties to a national best practice. So it'll be a more structured way in which we give this feedback in the future. And I know in small, large group and school age, right now what you get primarily is a list of noncompliances and then a narrative that might have some of that other information in it, but it will be part of what you get as a response from EEC from your visits. We are really hoping that this is a proactive approach that shows the partnership that we have with providers and really reflects the fact that we want providers to feel comfortable coming to EEC with questions about the regulations. We're hoping that our increased ability to be in programs will help deepen that relationship. It's not a secret that in some cases in family child care, we don't get to programs but at the renewal cycle. So in some cases we're not seeing you but once every 3 years for family child care, and that's really not sufficient. It's not sufficient for us to support your compliance, and it's really not sufficient for us to develop a positive working relationship with you. So this new model will really help us to do that. some of the differences from today. Back in the day, some of you who have been licensed for a very long time know that we have done unannounced visits before in the past, but lately most of our visits that were unannounced had to do with situations that were probably not positive, and so we're shifting that. Some of these monitoring visits that we'll be doing will in fact be unannounced. Your renewal visits will be unannounced because in order for us to be able to meet the block grant requirements, the only way in which we can do this is to have the default for our visits be unannounced, and they would be announced when there's some reason why we have to do that. We do know that that might mean that we don't find somebody at home if it's family child care, and we'll return and try another day. The bottom line is this is a federal requirement that we must meet, but as Tina mentioned earlier, it's also a best practice. We've learned through research, there's a lot of research on this subject, that knowing an unannounced visit might occur actually does improve the chance that a provider will be in compliance. But we do recognize that that can be an uncomfortable feeling, especially since the history with that has been that it's always for a negative purpose. We're really trying to shift the idea of monitoring to be a positive frame and not a negative frame. And we will be there more often. Yearly is the goal. And obviously, if you're seeing us at that level at this point, and then we're already there. In some regional offices, some licensors are hitting that mark right now. In others, caseloads are such that that's not the case, but we really are targeting to be able to do that with everyone, and to have time during that visit where we do observations, where we're able to give you feedback, where you're able to ask us questions, where you're able to talk about the things that you might be having some issue with and need further guidance on, and we can refer you to resources. So we're building time in, less time looking at the tools and figuring out compliance, and more time to be able to have real conversations with you. And then these visits are compliance driven. If there are issues with compliance and lots of regulatory problems, then obviously the visits will take longer. And we have basically 3 levels of visits that we're doing, but at any point a licensor can look deeper into one area as opposed to another area. It's not necessarily that they're jumping from small, medium, large kind of tools. This is really a very dynamic monitoring technique that will reflect what we're seeing when we walk into your program or your home, and we make an assessment about your compliance. Obviously, if something was seriously wrong, we're not going to jump into a tool that causes us to be there for half the day. That wouldn't make sense. We really want to make sure that what we're doing targets those key indicators of risk for children, and that if something is serious, we're able to address it. But it's not necessarily that the next tool is bigger or more that we need to do. It might just be more depth that we need to cover. But overall, we're really hopeful that the majority of these visits will be compliant. Most people will fall into the category where you're able to go through these visits and have us do more focused tools. So I think we're ready for questions, Zane.
Okie dokie. So we've gotten a few so far here, and just to point out, if you have any questions, please just send them privately to me, Zane Wyrick, over the chat feature of the WebEx application. So starting out, the question is, if high-risk programs are going to be monitored more frequently, why can't programs with long-standing records of excellence, say 5 years or more without violations, be relicensed every 3 or 4 years?
So the question is about a program who has a high level of compliance over a period of time, let's say 5 years. Why can't the renewal, could the renewal be a shorter period of time as well, or a longer period of time as well, I'm sorry. Is that Zane, the question?
Yeah.
Okay, so the time period on the renewal will not change. The licensors are driven by the regulations, and the regulations for small group and large group are for a 2-year cycle. For family child care, they're for a 3-year cycle. But what we do on that renewal visit could, in fact, be different. And we did, after talking with other states, decide that there would be some period of time for everybody where we came back and did a full renewal review, but that period of time could be longer depending on your compliance history. And those timetables are slightly different for family and group child care because of the difference in the licensing cycles. But I could use group child care as an example. If you have a regular monitoring visit, a focused monitoring visit in your first renewal, your next renewal, if you're compliant, could be either that or an enhanced monitoring visit. And then once every 6 years in your renewal cycle, you would have a full visit so that we could revisit some of those regulations we perhaps haven't gone over with you in a while.
Okay. So that kind of goes with a question about I am seeing about renewal visits. Are they going to remain to be announced and pre-planned?
No, they are not. In order for us to be able to meet the requirement, it's not possible for us to make those announced visits. Otherwise, we wouldn't be making that unannounced yearly benchmark.
So renewal processes in terms of forms that must be submitted will stay the same.
That will stay the same. If you think about separating the renewal process from the renewal visit, the visit itself has to be unannounced, but you'll know when your renewal is coming up because your license will expire at the same time. So you'll get your paperwork during that same period of time. So there'll be a window during which EEC will make that unannounced visit for a renewal. Mm-hmm.
Okay. I am seeing a whole lot of questions come in, so I'm going to try and triage these pretty well. The first major one I'm seeing a lot is, can we talk a little bit more about the levels of visiting and the different types of visits? And
yes,
along with that, can you go into detail about what are the key indicators?
Absolutely. There are really 3 types of visits. There's the visits that you're familiar with right now, which would be what we're calling the full tool, and those are the renewal visits, pre-licensing visits, the visits that licensors have been doing at your programs. And then there are 2 other types of visits. The monitoring, which is our most focused tool, that has for family child care 4 key indicator domains in it. I'm going to stick with the higher level because we have a lot of other questions we want to answer. Those domains are physical space, indoor and outdoor, and it focuses on a handful of those items as opposed to all of them. Routines and activities, we're measuring 5 particular things under that or 3 particular things under that as opposed to the whole list. Interactions, which should be supervision, inappropriate child guidance, unapproved caregivers, those would be key indicators of risk, and then administration. And for family child care, those things are overcapacity, an unapproved person on the premises, a lack of CPR and first aid, for example. So the domains are fairly high level. The key indicators are quite specific. And for that visit, for example, if the licensor found a noncompliance in one of those areas or in one of those key indicators, they have options. They can step up to the next tool, which is a little more robust, or they can, what we're telling them, drill in to the item on that tool. So they could look further at the supervision if that was an area that they were finding noncompliance in, and ask you further questions about that or gather further documentation from you about that, rather than necessarily having to step into a longer visit. It might not be required. It might be one area of many. For group and school age, the domains are care of children, and, you know, basically that you have an appropriate staff ratio and group size, that educators are following infant safe sleep practices as a couple of examples of those key indicators. Second domain is health, which is somewhat self-explanatory, but it's really the high-ticket items under health that we'd be looking at, things that there's not a toxic substance available to a child, for example. Then physical space, that your indoor and outdoor space is clean, safe, and in good repair. And administration, that you have a qualified administrator, that you have appropriate personnel records for your staff, and that if you do transportation, then we would be looking at some transportation items as well. Obviously, not all programs provide transportation, so that wouldn't be handled on every visit. In addition to these things, there will be some random items on the tools. that the system will generate for us to look at. And that's really so that the tools aren't so predictable that people are essentially complying to the test, so to speak. We want to make sure that it is a dynamic tool, that it does show us different things in your programs, and that it really does give us a snapshot of what's happening on the particular day we're in the program. I don't know if you want to add anything to that, Carmel.
No, I think you've covered.
Okay.
Yeah.
Okay, to follow that, just because we have many questions to get to follow that up, and the obvious question is, will these indicators be released to the public for everybody to access and know what they are?
We actually talked about this on the call earlier today. We have always been transparent with our tools. None of these are different from what are on the tools right now. They're a subset of what's already in your observation record in group and school age, for example. So if you look at that tool, these are in that. We would certainly be willing to send out the domains and the key indicators, but I think it's really important to remember that this is a living, breathing, dynamic tool that will change based on what we're seeing in your program. So if we came out and you had a copy of the key indicators, we might look at some things that are outside of that list, and I think it's just important that people understand that and they expect that that could happen and will happen.
Absolutely.
Okay, to follow that up, there is another question that's become very prevalent right now. Is there a window of time that will be around when a unannounced renewal visit will occur? Say 1 month, 2 months, 3 months, anything like that?
Yes, there is, and I'm looking at Tina because I can't remember if it's different for family or group, but
it's the window for the annual visit, 2 months before and 2 months after.
Okay, so it could be as wide as a 4-month window for both family child care and group child care, and that, depending on when we come in that window, could potentially move the window for the next visit.
Exactly.
And really the purpose of that is we know that your programs have different cycles during different times of the year. Seasonality has a big part to do with it, especially if you think about outdoor space. You're not going to be using your playground in the snow, right? So being able to have that flexibility to see your program at all times of the year.
Yes.
Okay. The next question I have here, talking about submitting, if the renewal forms will be able to be submitted online.
Yes, they will, and that's less of a question about differential licensing and more of a question about the new IT system, so I will give the shortest answer I can here. We hope to be able to do that with family child care when we roll out the differential licensing model in the fall, and with group, school age, and residential and placement later in 2016, probably December, January of next year.
And so EAC will provide communication as well as training materials.
Absolutely. There'll be training and information and a lot more available on that.
Right. As soon as we know that we're ready to release that information, we will definitely have more information available and information sessions for providers and educators.
Yes.
Okay. Since there was a little bit of discussion on timeline there, let's talk about timelines. I've got some questions here about, so if somebody had a renewal, shoot, I've lost the question. If somebody had a renewal in 2016, when are they going to next have a renewal? And or when are they going to be part of the first group in 2017 for getting these unannounced visits?
That is a question actually I don't have a direct answer to. We are in the process of figuring out how we phase the model in, because obviously we can't start everybody at the same place, or we wind up without a phased model and we'll never be able to meet the benchmark if we're doing everybody's full renewal visit the first year. So it will relate to the compliance history of the program, but there may also be some timing related to it, because you know, if you're a provider who's been licensed for less time, it may be that you're in that first group, but we haven't really figured those details out at this point. But not everybody will start at the same place, but everyone will get some kind of an annual visit.
Okay. Just to clarify again, say if your license expires in October, for example, and the license meeting is going to be in August, are you saying that that person has to be fully ready in August?
Yes, because that person probably either already, if they're family child, they already have their application, and we will not have implemented the differential licensing model yet. So any visits that we're doing before the model is implemented will be the legacy visits. So if your licensor shows up tomorrow with their iPad, the visit that they are doing at your home using that device is the visit we've always done. It's not a different visit.
While Dane's still looking for the next question, it's important to note that this is a model that will be phased out over time. EEC will be collecting information and feedback from licensors as well as providers throughout this process because it is a new process. We've talked to other states who have also gone through this, and you know, the first few years are really a learning process, and we're going to be perfecting the model as we go.
Yeah, and you know, Tina just said it, it's a learning curve. It's a learning curve for the licensors at the same time that it's a learning curve for all of you. And I think we all have to be understanding and sort of gentle with one another as we embark down a road of significant change for licensing.
Okay, so I have another question. How, if at all, will the differential licensing align with current QRIS procedures?
The best practices are actually the places in which the two things begin to come together because they are recognizing some of the requirements underneath QRIS because those are best practices.
Okay, I've got another question here. When will the EEC orientations take place?
I need a little more information from that question. Do you mean the orientations about this model, or do you mean the family child care orientations that we do for new providers or group providers?
That I can't answer, so we're going to go on to a next question here. Neither renewal orientations.
I think if this question is coming from small group or large group and school age, then we will still be doing our renewal meetings the same way we've always done them. The content may change slightly because we may need to explain some of these new data systems during that renewal meeting, but we will still be doing them as we always have within a few months before the renewal, and people are invited and they can attend any region that they wish to.
Okay.
I'm going to assume that was the question.
I think that answered it. Another question here. How will request for capacity changes work?
That, again, is not part of the differential licensing model. That would be part of the licensing process, and that process would be the same as it is now. And you know, it may be that it gets combined with an annual visit, but if it's an announced visit to look at something, then it would not be part of that annual requirement.
So a little bit more on the process for the risk indicators. Can you explain a little bit more thoroughly on what is considered a high-risk program in large group care for group school age, and how does the licensor determine this?
The licensor is using specific criteria to determine that. I'm going to look at the list. They're pretty high-ticket items that place a child at immediate risk of harm. And I think we're talking about the fact that maybe many of these items are non-compliant. It's not one thing on this list, it's many things on this list that would be an indicator of a program that was really struggling. I'll just quickly go through a handful of things on the list. Maintaining an appropriate child ratio and appropriate group size. And, you know, as an example, there's sort of small noncompliance with that and large noncompliance with that. It really depends. If we walked into a group child care program with one staff person and 40 children, that would be imminent risk of harm. That would be a very serious violation. And obviously we would deal with that differently than we might if we walked into a situation where there was less noncompliance or more substantial compliance than that. Some of the other issues are things like toxic substances, that the space is not safe, clean, and in good repair. And if it was overall that the entire program was in that state of affairs, that would be imminent risk of harm to children. The program not having qualified staff or qualified administration places children at risk. And we recognize in group and school age that we really are experiencing staffing issues and staffing shortages, and so we are taking that into account as we make these assessments. It might be that we're aware somebody's looking for a newly certified teacher and that they are getting ready to hire somebody and that person's going to start in 2 days. That, I think, is a little bit different citation than the program has infants and doesn't have any qualified staff to care for them and isn't in a situation where they even have an infant license. So I'm trying to put the extremes out there so people can kind of understand where we're coming from with this. I mean, the idea is that these are the items that are very basic to children's health and safety. So most programs are likely to be doing these things right and to be doing these things well.
I also think that it's important for programs and educators to realize that these key indicators aren't looked at in a vacuum as to it's a snapshot in time when a licensor goes in there. Past licensing history will be viewed before a licensor goes into a program to see what noncompliances, if any, exist before they go in for a monitoring visit.
Okay, I've got another question here. Does this training that we're in now, or rather this webinar, does this count for the PQ registry, and will a certificate be generated?
No, that is not our intention. This is an informational webinar, not a training.
So if someone's licensing renewal, or if a license is up in December, at that point, will there be a different renewal form, or should they just send in the form and the licensing fees?
They will receive the same licensing process that they have now. The difference come December, depending on the particular type of program, might be that that person could apply online through our new system. But again, that's not a differential licensing question. That's a question to do with the new IT system. So you should check with your licensor as you get closer to your renewal to find out what's available to you.
And there was going along.
Go ahead, Zane. I'm done.
Okay. Going along with that, talking about your licensors are going to remain the same, correct?
There is no intention at this point to change licensors, but the numbers of providers assigned to any particular licensor on a given day do shift and vary, so it is possible that somebody on the call may wind up with a different licensor than they have today, but that won't be based on the differential licensing rollout. That'll be based on the fact that the licensor needs to be changed because we need to meet a caseload need.
Okay. Talking about visits, when licensors do show up, the question is, what happens if the director of the program is either a teacher or isn't there and they're pulled away for an unannounced visit, or they're not there for an unannounced visit, one or the other, can you explain how that's taken into consideration?
If the program is operating within the regulations and within those regulatory requirements, and it is acceptable for the director to not be there, and it falls within those categories that the regulations allow because we recognize the director can't be there 24 hours a day, every single day, then that would be fine. It may be that if there are things that we would need to find out from the director that only the director should be able to answer, then we're not going to be able to get the answer to that on that day. But if it's something that only the director can answer that other people at the program should know, then that could be an issue.
I know we're not trying to talk about the lead system, but I'm getting a lot more questions based on just whether there are going to be any planned orientations for the new IT system.
There will be some information that will be shared once the what we call the provider portal goes live. Right now there is limited access for providers and educators to access the lead system. It's on a limited basis, but once it becomes more robust with its capabilities, we will have more information available, and we will definitely provide more information to both family child care and to group and school age provider communities so that they have that ability. We expect that would be more towards later fall. Yep.
Okay. So here's a question that we had earlier today. With an association with multiple programs, are all programs looked at for compliance, or is each program looked at as an individual program?
Just like it is now, each program is looked at as an individual program.
Okay. And just to reiterate, folks, that this call is an informational webinar and not a training. How do these new differential visits affect certified assistants in family child care? Are they still treated as a full provider and as such have review visits separately from providers?
We don't visit certified assistants because the person is approved by EEC, not the facility. So if a certified assistant happens to be operating a family child care home when we show up for a visit, then we will visit with that person and have an interaction with them. Otherwise, it will be the process as it is today. And they will also be able, through the new system, to apply online. I did see a question, Zane, pop up on the screen about what if a provider isn't home. And I think that's probably an important one to answer because we know that is going to happen in group child care. I mean, in family child care. It could also happen in group child care if the program is off on a field trip and nobody's there on a day we show up for an unannounced visit. That's perfectly fine. We'll have to come back at another time. If we're not announcing it and you're not expecting us, we can't expect that you're going to be there every day.
I see another question here. If a program is always in compliance, when they still get an unannounced visit yearly?
Yes, all programs have to have an unannounced visit yearly in order for EEC to meet the block grant requirements.
I had to mute again. Let's see here. Still getting questions on timing here. If a license expires towards the end of this year, when is differential licensing? When are we truly anticipating it rolling out and affecting licensing renewals?
This fall, we're expecting it rolling out. And we still have not determined at this time exactly which renewals for which folks will be the new way, the old way, the in-between way. We're still figuring out how to phase it in.
So I think it's important to remember that the renewal paperwork and processes for that will stay the same. So you'll still submit the same paperwork at the same time that you do today, because your visit might look a little different.
Right. And you will all know as soon as we have any kind of automated system where you could apply for a license, because we are as anxious for you to use it as you might be to utilize it.
Okay, I've got another question here that I missed earlier. Will licensors receive training on best practices and developmentally appropriate curriculum, environments, and interactions?
Could you repeat the question, Zane?
Will licensors receive training on the best practices and developmentally appropriate curriculum, environments, and interactions?
Well, licensors have received training on differential licensing, and licensors are expected to know developmentally appropriate practice and curriculum development.
Do you need the providers to receive that training?
I'm a little confused by the question.
Okay. Well, while they write a response, I've got another question here. If you are a teacher and a director in a one classroom center, or you are the director and you also teach class, how will unannounced visits work when the director is being pulled away from? Go ahead.
Yep. That's a great question, actually, and the differential licensing group grappled with this a lot, and I think that there is a recognition by the licensors that we have to be sensitive to what we're walking into, and that we don't necessarily want to pull someone out of a classroom, and that's what they're supposed to be doing at the moment we happen to show up unannounced. So we're going to let what's happening in that program play out and conduct our visit around it. We would only interrupt what was happening with that director if we happened to see something that was serious that needed to be addressed.
Is it possible for an unannounced visit to occur within the same year? That is, 2 unannounced visits within 365 days, if I'm reading that correctly.
Yes, it is possible, depending on how the timing works out. And as many folks on the phone know, EEC does unannounced visits for other purposes. So if we needed to come out and do an investigation, or if you reported an incident, we may indeed come out unannounced to do with that. So not every unannounced visit will be part of this model, and at this point we're still waiting for some clarity from the federal government about how those visits can factor into the yearly number.
Okay. So we're just past our time, so I want to take a moment to just reiterate, we have recorded this webinar and we will be working to post it publicly. We're working to make sure that all of your questions have been recorded, and we'll work to aggregate them into a larger FAQ to add on to what we've already sent out. Anything else you want to add to how we're responding to any further questions in regards to differential licensing, folks?
No, I appreciate you gathering the questions, Zane, and we will do our best to take all the questions and, like you said, add them on to the FAQ that's already been developed.
And thank you to everybody for calling in. It's, you know, we understand it's a long day and it's 7:30 at night, and so we really, really appreciate your willingness to take time out of your evening after working the many hours that you do during the day to be on this call and to listen to us talk about our new model of licensing.
So thank you. We'll post information, as we mentioned, online and let you know. And be in communication as more information is out, especially regarding the provider portal. We got a lot of questions about that.
Yes.
Thank you, everyone. Have a great night.
Thank you. Have a great
Thanks,
night.
folks.
Thank you.
Thank you. No, es de la pantalla.
Thanks. Bye, Anisha. Thank you.
Thank you.
Thank you from Anna.
Thank you, everyone. Have a good night.
You too.
Bye, everybody.
Thank you. Good night.
Thank you.
I think that was it.